guys, welcome to your daily dose of vitamin E. If you don't know what vitamin E stands for, why don't you join the family and find out what this stands for. Well, let me just put it here. So vitamin E stands for anti-aging. It means we don't grow old, we keep shining, positive vibes, refreshing content coming your way every single time you stay tuned to this channel. So with that being said, don't forget to click on the like button, don't forget to subscribe, and don't forget to turn on your post notifications in I think the right side. Yeah. So with that being said, let's get right into the video. By the thumbnail, you already have an idea of what this video is about. I actually had the inspiration by God to make this video, and then my friends' encouragement, and decided to put the video out there. So I'll start directly by going through all the tips. Please ensure to take note of every single tip, and please share to anyone in need of this video. So with that being said, let's get into the success tips. So tip 1 is God. We need God in every aspect of our life, literally. Like, that can be overemphasized. Yeah, but this is a time where you really need to hold him so tight, like hold him tenaciously, because you can't just handle this whole phase on your own. Trust me, it won't be possible with your human strength. And so this is the time you need to hold tightly to God. If you've been like on a loose rope, please have a grip. You need God because he's the only one that feels deeply and like can experience exactly what you're going through. Anytime you're down, you're sad, you're having like mixed feelings, mixed emotions, just have a word of prayer, communicate to God. I don't know what religion you might be, but hold on to your God so tight and like ask him for help, ask him for direction, because you can read a material over and over and over and you feel you're like dwelling so much on that material, and maybe you might be exhausted, and that time you just need God to step in. Second tip is your mindset. It's the time where you need to be positive. In as much as I might say be positive and you're like, what I'm going through, is it the time for me to actually be positive? Because it's actually emotionally draining. But this is the time you just need to hold yourself tight and stand positive. You would not be able to do so much for yourself if you have negative thoughts or negative inspirations. This is time to do away with every negativity in your way. Surround yourself with positive friends, surround yourself with positive minded people. Sometimes you might be so down and you're like, did I actually sign up for this? Like, did I sign up for this? But you're already in it, and there's a reason why you're in it. So why don't you take the opportunity of having that positive mindset that you're going to scale through it? Don't be scared. Please, I'm begging you not to be scared, because fear is something that is temporary and fear doesn't last. Fear just discourages you from doing a lot of things that you're able to do. So what you don't see can kill you. What you don't see actually makes you stronger. This phase is going to pass and you have a story to tell. Another thing to add according to positivity is be mentally prepared, because this phase is really draining emotionally, physically, mentally, and spiritually. But you don't want this phase to actually define who you are. Always tell yourself you can do it. Emotionally, tell yourself you're strong, nothing can bring you down. You have the right to anything. So you have the power. Everything is in your control. Nothing can control your emotions. Nothing can control your feelings. So keep reminding yourself that you have the power over this, and it's something you can't see. So yeah, and spiritually too, it could be draining mentally, physically too. You might feel you're losing some weight, you're not like being you're not achieving your body goals, because like medicine, it's draining, so you're not eating well, you have anorexia and the rest. But do something to curb that situation. That's to prevent the situation, than allowing the situation take a complete control over your life. Another tip is attend classes. I'm sure a lot of you are like, attend classes, like what's this girl saying, what's this baby yarning? But like, attend classes is something that might seem not productive, but at the aftermath of your exams, you actually appreciate the fact that you attend classes. Attending classes helps so much in determining what is in the heart of your lecturers, determining what is in the mind of your lecturers. So your lecturers can actually come to class and teach a topic, and then they set like tags, key points where they lay emphasis on and where you're going to be required to answer in the exams. So attending the classes like helps you listen. If you're someone that doesn't listen for a very long time, you can maybe try and walk around, chew gums to expand your attention span in class. It might seem like a waste of time, but then once you listen to these lecturers, they tell you what they can ask in exams, like specific parts in their notes and in their topics that are very essential for you as a doctor and for you to pass these exams. So devote that little time to attending classes, and also it facilitates your reading, makes you read faster if you actually understand the basics of the topic in class. So when you're going through it that day, if possible, or the next day, you'll be able to read your notes very fast, and then you'll be able to like understand what this material is about. So attending classes actually pays a lot because you have a whole lot of material to read, and lots of materials will keep popping up, and then attending these classes would ease up the stress of you reading, figuring information on your own, researching deep, because the lecturer has done his own research, and then it's like bringing it forth to your table. And that reminds me, once you attend classes, do as much as possible to do justice to those classes by asking questions when you don't understand the material or you don't understand what this topic is about. So ask questions, like don't be ashamed, and productive questions, please. I'll be reading something out concerning attending classes. Last minute tutorial classes are also very important. Last minute tutorial classes are very important. So when you go for last minute tutorial classes, the lecturer knows that you have a whole lot of things to read, you have a lot to assimilate and put in your head. So the lecturer would want to ease you off that stress and tension you're in by like dropping AOCs, that's area of concentration, key points, and also like telling you what is so important and how to go about answering their questions in the exam hall. Another tip is practicals. Like practicals can be overemphasized. Like practicals are one of the easiest way for you to earn a lot of marks in medical school, because some practicals are fun, interesting, and there's something you do. So things you do repetitiously like makes you remember them, and then there's something you do effortlessly if possible to pass your exams. So try as much as possible to take your practicals very serious in medical school. I noticed during my time and subsequent people's eras, that a lot of people that actually did well in their practical, like maybe had 80 over 100 or like 90 over 100, and their theory and their MCQs, that's their multiple choice questions, weren't up to average. Their practicals help to skyrocket their points. Trust me, your practicals are taken very seriously in medical school. So please do as much as possible to ask questions in your practicals. Take note of every practical questions you'll be asked in class, and also do well in all your practicals, be it pharmacology, because pharmacology is alone, anatomic pathology, chem paths, and microbiology. So do well in all their practicals. Trust me, if you're someone that finds it difficult to read for long hours, it's very hard for you to understand the material, and then when you even read, you forget easily. And for your multiple choice questions, I can't ascertain where they're going to come from, why don't you take the advantage of using your practicals, which you're very sure would come out, and there are things you've done, so you're very sure of your practicals. Anyhow they twist it or turn the tables around, these are the practicals you're certain you have done. Instead of wasting so much time focusing on only your theory and your MCQ, your practicals are very, very important. Another point is make notes. Your jottings. As medical students, we tend to want to jot a lot, but are your jottings like important? Are your jottings straightforward? Are your jottings precise? Are your jottings like answering what needs to be answered in the exams? Why don't you make your jottings like the way you answer questions in the exam hall? So I'll go to a point, and that would help in your jottings. Make notes from what you read, obviously, but specifically highlight those areas where your lecturers tag as very important in your jottings. You could use a highlighter. I'll put an example here about how people organize their jottings, so when it comes to exams, you make reference to your jottings, and their jottings helps a lot in answering your questions precisely and in giving the lecturer what he wants. So coming to your jotting, things that you feel are so much and your brain can't just grasp them immediately, like use mnemonics. Mnemonics help a lot in medical school, especially when you read something like acid-base disorders. There are mnemonics like Mr. Maples, and that mnemonic can help you like refresh your memory and bring to your memory what is required for you. So use mnemonics a lot. You can use your friend's name, you can use your mom's name, you can joke around with your colleagues just for it to stick to your brain and help you assimilate a lot of the notes. Emphasize on your jottings what lecturers tag as importance in their notes, so you don't forget what the lecturer actually requests of you in their exam, so you can use it as a form of your jottings. Don't go and read a topic and rewrite the whole topic according to how the lecturer gave you in a slide in your notes, because that's waste of time, especially for people who have exams in a couple of weeks and you don't have that time to rewrite what the lecturer has given you in class. So another point is draft outline for answering your questions in the exam hall. Outlines help a lot to be able to make you answer questions precisely and straightforward to what the lecturer is actually asking of in the exam hall. Concerning mnemonics too, in your pharmacology, there are a lot of drugs to be crammed, a lot of classes of drugs, and you can't just recite those drugs and just cram them on their own. So mnemonics help a lot to be able to make those classifications of drugs that are so wide, simplified, and something you can remember, especially when you repetitiously ask yourself for those drugs. So you can paste these drugs in your room, paste the classification of drugs, be it antihypertensives, be it antidiabetics, be it any class of drug, paste them in your room. So in the exam, they actually talk about a drug in this class, at least these drugs belongs to so class, and you'll be able to write something instead of like just dwelling on one class of drug and forgetting the others. Mnemonics help a lot to be able to gather information about varieties of classifications of drugs. I don't know if you understand what I'm saying. You have to take your pharmacology very seriously because it is just one. I would put links or the YouTube videos that help you to draft mnemonics in pharmacology, especially towards the exam period. You don't want to go and sit down and be cramming. Someone that went precise and straightforward to their answers by making outlines during the course of their reading. So someone like that would end up passing and end up having a whole lot of high grades than you that has written the whole textbook, because you're not making it easy for the lecturer to get what he's actually demanding from you, and you're not making it easy for yourself either. So in your anatomic pathology, To make things easy for you when you sit for an exam and to earn a whole lot of mark from your lecturer, to create miles on your lecturer's face. In case of a disease now, and they tell you to talk about a disease, you can outline your work with these tips I'll put beside here. So you can outline it with the introduction, the etiology, and the etiology should encompass risk factors. You have your pathophysiology. After your pathophysiology, your clinical features, if I'm not mistaken. After your clinical features, you put your diagnosis. After your diagnosis, you put your investigation modalities for that disease state. And lastly, your conclusion. Oh, I forgot one thing that's very important in your anatomic pathology. You have your morphological features and your gross features, which comes before your clinical features. But don't worry about that. I'll put all the components of this outline by this side of the video or by this side, and so you'll be able to take cognizance of them and answer your questions like a brainiac. Make them know that you know what you're doing and earn a lot of good points from your lecturers. Pathology, outline your work is very important. Mostly chemical pathology loves calculations. I'll advise you in your chemical pathology, in your readings, take note of any calculation at all, every formula you'd be asked for. So in your hematology, your investigations are very, very important, and your treatments. In case of your investigations, know your supportive investigations, know your definitive investigations. For your treatments, know your definitive treatments and your supportive treatments here. So it's very important you know that in hematology. And also your vital readings, your PCV, know them very, very well. So when it comes to microbiology, know your classification of organisms and diseases they can present with. So for each classification of organisms, know at least some diseases that can be presented there. So for fungi, know the diseases, bacteria, parasites. No, don't just leave one out. Another thing I left out is your pharmacology. Please, as you're reading for the other courses, don't forget your pharmacology. Pharmacology is just one. Please, Ejo in Yoruba, Biko in Igbo. So for your pharmacology, drafting outline, I would put the outline to which you would be asked or demanded to answer questions in your exams by this side of the video. So for pharmacology, they say talk about a drug now. Things that are very important and essential to make the lecturer pleased with you in the exam is your know the class of the drug you're being asked. That's why knowing at least examples under each class of drug is very important. Know the class of the drug, followed by its mechanism of action, followed by its pharmacokinetics, followed by its pharmacodynamics. So for its pharmacokinetics, it involves absorption, distribution, excretion, and metabolism. Those are the key parts in your pharmacokinetics. For your pharmacodynamics, drug-drug interactions, no certain drugs that when you take with the drug you're asked for in pharmacology of a drug. Don't go and focus on one lecturer's part and forget another lecturer's part. Try and do justice to all classes of drugs, at least one or two per lecturer. So another thing is self-discipline and procrastination. Procrastination is a thief of time. You have to be disciplined when it comes to sleeping, eating, or doing anything, because right now time is limited. Like, allocate proper time to anything you're doing at all. I feel you have a lot of time, exam is still far, and as you keep thinking that, exam just comes to your face and smiles at you and say, hello, I'm here. Another tip is know what works for you. So as a medical student, sometimes you get intimidated by each other because you're like, oh, this is my medical student, oh, this my friend goes to read the library and spends 10 hours. Oh my boy, I could go spend 11 hours. So it doesn't work that way. Like, do what works for you. Try as much as possible to read in a day at least, even if it's just a one line bold dead sentence that is highlighted in the lecturer's notes. Just do something. It's when you do something that it amounts into plenty, and when you get to the exam hall, you'll be grateful for those little times you spent at least doing something. Another tip is watch YouTube videos. Watching YouTube videos actually help for people that are visual. They want to see and understand what they are reading. So do as much as possible to use YouTube videos to hasten your reading. You might think these YouTube videos are going to take a lot of your time, but surprisingly, these YouTube videos do justice to each topics, and they could be 5 minutes, 10 minutes, and they will help you understand the material. So why don't you take advantage of YouTube videos? Another one is study groups. I'm not really a fan of study groups, but a lot of people in my compilation of what works for them said study groups actually help. Just make sure that the study groups are with people that are focused. Locate past questions in your study groups, answer past questions. Don't just try saying everybody go and focus on a topic. Like today, we're taking breast cancer. Everybody go and read on breast cancer. We'll talk about breast cancer. You don't have a lot of time, especially when it's towards your exam period. So you can divide several topics between yourselves. Someone will use 30 minutes to just go through the important things in their topic, and that person used 30 minutes to go through the important thing in their own topic, and then you'll be able to encompass a wide scope of knowledge in all these topics. So study groups help a lot, because when you get to the exam hall and they ask you that question, you see it and you're like, oh my god, my friend said so thing. Another tip is don't dwell on past failures. So for people who have already done Path and Pharm 1, it's Pathology and Pharmacology Block 1, and perhaps you saw your cumulative scores and they were down, and you feel like the whole world has crumbled, you don't know how you can make up for it. There is still time. You can still make up for it. Trust me, during my time, people that didn't really do well in Block 1 but stepped up their games in Block 2 actually passed in flying colors at the end of their professional exam. Eat well to boost your immunity, because you're overworking yourself, and sicknesses can thrive in someone who is immunocompromised. So lastly, reassess yourself. There's one thing with reading and there's one thing with not reassessing yourself. Reassessing yourself comes in several ways. It comes in asking yourself, oh, okay, so I've read on diabetes now. What are the classifications under diabetes? So I've read the definition. What is the definition? So reassessing yourself can also be in the form of explaining it to your friends, to your colleagues, to be able to help your friends and also help yourself, because the more you teach, the more you're able to retain some materials and know where you need to work harder in. Reassessing yourself could also be using past questions. Don't dwell so much on past questions, but you could use it to reassess yourself on what you have read. So with the whole tip, I hope you pass your Path and Pharm in flying colors. I wish you all the best. Always remember that you're stronger than you seem. Nothing would actually weigh you down except you allow it to weigh you down, and you're bigger than the situation. No situation is also permanent, and people have done this before, so you're not going to be indifferent. You're going to also pass this exam in flying colors. If you're sad, you need someone to cry to, do that. Crying is not a sign of weakness. Instead, it shows that you're strong. You're able to feel the emotions that come with that situation, and you're able to move on from it. Don't forget to thank my friends in the comment section. I'll put their pictures. So please thank them so much for their success, and they actually devoted their time to sit down and write it down. And I love y'all so much. Don't forget to subscribe. Oh, subscribe more. This my 15 hours can't be waste. Oh, all right. Bye, guys.
I know you want to move my body. You know the girl who likes it, party, na na na, na na na. Running around and you can talk to me. Come and take my hand until the night, and na na na, na na na. Don't know is it too